Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. This patient's come through with a very blocked up ear. You can see quite a large chunk of wax in here. It looks quite soft from the outside edge but completely filling the canal. So we're using the standard size Zollner tube just to go into the canal here and gently start to peel away from the outside edges. Just getting a feel for how blocked this ear canal is, how much this earwax is moving here. So we're just gently working our way around the outside, and as we're doing so, just giving a little bit of a wiggle here and there, just to see whether we get some movement to this front end of the wax, and depending on how much movement we get, we'll know then if this is going to come out in one chunk or not. So we just unstuck from the base section there. Introducing a little bit of olive oil, which is going to help because the outside of this wax is very, very sticky. The olive oil just stops it when you do peel it away from the canal wall from sticking or reattaching back to the canal wall afterwards. So a little bit of dry skin and dry wax there to the base. We're just trying to peel away from the left side as well. Concentrating on the bottom there. Just starting to peel away a little bit more effectively now. As we lift up, you can see what we're looking for is, instead of the edge of the wax just peeling in, we're looking for a whole movement, and you can see it just starting there. So when we lift the bottom section, instead of that just outside edge moving, the whole front end of the wax is moving. See, as we're doing it there? But I can tell by that movement that it's still quite firmly attached either to the top or further in. So I'm going to see if I can give it a little bit more of a wiggle. There you go, just rocking back and forth and up and down. Doesn't really seem to want to come away. Now that's normally an indication either the wax is quite long and there's a lot further in that's holding it in place, or that it's still quite firmly attached at the top end there. So I'm just checking around the outside edges, see if we get a bit more movement anywhere else. Doesn't look like it, so we're going to opt for the Jobson horn now. Just going to go above the top section of wax, then pull down. Aiming always for that little tiny gap between wax and canal wall until we can get in that little bit further, which gives us a bit of leverage behind the wax. You can see it coming away here, so we'll just switch position now, so a bit further in. And carry on pulling. So as we thought, it was quite a long piece, so attached much further in. Quite a chunky bit of wax, that one. You can see a bit of dead skin there at the base. But when you take that away, it came away in one nice plug. Eardrum itself is looking nice and shiny and healthy. So it's looking really good. So this was the plug, so just under 1.5 cm, which will pop up again in inches now, so just over half an inch. So yeah, quite a substantial piece, that one, and perfectly formed to the shape of the canal. Patient very relieved to get that out. That was an absolute plug. Okay, second patient in the compilation. So what we'll see here, very, very deep wax. One of the most difficult type to do, this one. This patient is a self-confessed cotton bud user, or Q-tip user if you're from the US. And what you'll see is that the wax is formed into the shape of the end of the Q-tip. So you have a very deep depression in the center, but the outside edge of the wax is actually stuck to the canal wall where that hasn't been pushed further in. So you end up with this very sort of bowl shape, if you like, the inside of a bowl. So what we're going to do now is I've put some olive oil in here because we need to loosen this. These are always really, really tough extractions to do because the wax itself is normally compressed, so it's going to be a lot harder because of the Q-tip use. It's going to be dry because it's very deep in the canal. It's where it shouldn't be, so the mechanisms for expelling the wax are not located down this deep in the canal, and it's 9 times out of 10 resting right against the eardrum. What complicates things a little bit further in this patient is that they have a very pronounced piece of cartilage at the bottom of the ear. on the pinner, the outer part of the ear, which means it's really difficult to get the tools in over that and into this deeper section, so I'm left with not very much room at all. So what we're doing here is using the very fine end here on the end of the suction tube just to lift the outside edges away first. This is always very delicate because it's in the sensitive part of the ear, and because you're working very close to the canal walls, you do run the risk of scraping, scratching, a little bit of bleeding sometimes if you dig into these canal walls. It's really solid, it's not budging at all, so we're just trying to work our way around this now. So just peeling away the right side. See, it's folding in. Now the difficulty when it's this deep is you get, especially when it's being compressed into this space, there's a slight flare, if you like, in the eardrum when it at the ear canal when it reaches the eardrum. So what can happen sometimes is it looks quite small from the outside edge, but there's a rim around it that's pushed into this gap around the end of the canal where it meets the eardrum, which means it's very difficult to just pull these out because that rim will hold it in place, especially if it's dried out. So we're having to go very gently all the way around the outside edge of this wax just to try and loosen and kind of pull it into the canal, trying to get it away from the eardrum as much as we can. We're still lifting that bottom section. I'm going in with the bigger Zollner tube here now because I've lifted the base, so I'm hoping to try and get a good grip on this to pull it out. It is hard because you can see that's the size of the standard size Zollner tube. So we've got a very small canal. It's difficult to get the endoscope and the Zollner tube really close together at the base of this canal, so we're having to leave the endoscope further back, which is not ideal, but it is allowing us to move some of this wax. You can see the eardrum now starting to appear behind, so that section there to the right side, that bluish grey section. But it's this left hand piece here that's causing us the issue. It's where I said it was wedged. It was quite wedged into that gap. What you saw then was a little bit of the olive oil, a droplet of olive oil just passed over the camera, which is where that distortion on the lens was there. Just lifting from the base now, trying to get it out of that groove. But as hard as what we're trying to do is hold the suction onto this piece of wax. Very gentle wiggle back and forth. We don't want to cause too much wiggle because it'll press against the drum, which is obviously very very uncomfortable for the patient. Now try and work this top section down. Another droplet of olive oil. This is the catch-22 of olive oil. It helps a lot to get these pieces of wax out, but you do tend to sometimes get this little kind of pool or droplets forming on the cilla as you introduce the oil, so it can then start to blur the lens a little bit. Just peeling away from the right side. You can see just how tough this wax is. It's all really solid, and it's all tucked into that groove on the left and down into the bottom section there. Just trying our best not to hold on, not to press too far into the wax, more to kind of bring it towards us. So aiming for the bottom again there now, and just try to lift anywhere out of that gap. But as you can see, it's really just wedged in there. The patient's done a really good job of causing a few issues with this using that cotton bud. The top now has started to peel away slightly, so I'm going to aim for the top section now with the fine end to give me a bit more room in here. We don't opt to use the fine end when it's really hard like this because you just don't get the suction grip. But if you've got the wax moving and then it's just a case of kind of trying to maneuver out of that section, the fine end's great because it gives you a lot more room to maneuver this. You can see we've pulled it down from the top now. A little bit more olive oil gone in just to try and help us. There you go. So that's pulled the front section away from that wax now. Going to go back in again. You can see that deeper section. We really flooded this canal with olive oil just to give us the best chance of sliding this out. Trying to get a grip on the top to pull it further out. There we go. So it's just moved out from the top section. You can see now we can't get a good enough suction grip with the fine end. It's just too angular, and it's just not going to produce enough suction power to hold on to this. So we're going to switch back now to the standard size, which should give us a bit more power. There we go, got a good grip. Trying to maneuver this. You can see it's really difficult to try and find a good edge because it's formed this plate. You've got this really narrow edge at the front, so it's difficult to get a good grip on there, and there's not a lot of room in there to really get a grip on it, another part of it here. So just back in now, just try again, see if we can get a good grip. You can see I'm trying to turn the wax here, just trying to find any smoother surface I can get a grip on. There we go, there we go. Out it comes, and there's the eardrum, all looking intact. So it looks really it looks pathetic on here, but it took so long to get out. It's just over 0.5 centimetre, just over 1/4 inch. There we go.
Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.